I guess I would like to know just from the start is um, how you've been using Cosmos in your practice, and kind of just maybe an overall view of where you found benefit.
The second place where I practice is where I work is at Wayne State School of Medicine. And so I wear quite a few hats there. So one of them is predominantly a teaching hat. And so I use the Cosmos in that role with the medical students. So in the medical school, they have a state of the art, to be honest, ultrasound training through all 4 years of their medical school. And so the first 2 years are handled by a colleague of mine at another hospital in Detroit. And then years 3 and 4 are kind of my baby. And so we use the Cosmos as part of our fleet for teaching. That keeps us quite mobile. We can kind of bring teaching to any location in the School of Medicine and not have to rely on like the fleet of systems that they have at the school. And then because of the kind of like the unique AI features, it really kind of enhances the sort of case-based modular type learning we do with the 3rd year and 4th year medical students. Just as an example, like in terms of image interpretation, having like an automated like quantification of ejection fraction that's based on the machine and their images, that's not me telling them what I think it is, gives them like another set of eyes when they're out learning on their own to help kind of confirm or refute what they think they're seeing when they're doing it. So it has a big role for us in that setting. And then the next kind of place where I practice is a small rural hospital on the west side of the state in Michigan. It's about halfway between Kalamazoo and Grand Rapids. It's a critical access hospital, which means that there's less than 25 beds in the entire hospital. Generally speaking, and I kind of joke about this, but it's more true than it probably should be. I think a lot of the hours when I work there, I'm the only awake, sober doctor in the entire county. And so it's a really like, it all falls on you, buddy. When you're working, you're literally the only show in town. And it's always been resource limited there. But with the COVID added into the limited resource environment, it's now become like staff and personnel limited. So as an example, there'll be some weekends where we don't have a lab there. And so because there's like 2 lab techs and one of them refused to get vaccinated, so lost her job. And so we'll have like a whole weekend where there's no labs. And they will they'll courier the labs down the road about 25 miles. And that works kind of, but they don't do all the tests that we would like to do because we're contracting with them, right? So we don't want to the hospital doesn't want to pay as part of the contract to have some tests that may not get run in a month. So they'll do like a limited set of tests for us. And, occasionally the courier thing just fails. The courier doesn't show up or goes to Starbucks on the way. Who knows what happens, right? Another thing that happened there was they lost their echocardiographer. So they had one echo tech that was working there. And I think it was over vaccination status as well. And so they're no longer there. And so pretty much any cardiac admit needs to go. Back before COVID, or I'd say before this last sort of like wave where we lost all our staff, a lot of those patients who had chest pain could stay at the hospital, right? We have 25 beds, we can admit them there. They can get some manner of cardiovascular testing the next day, and we can take it from there. If everything's normal, they can be discharged. But now, without any real meaningful cardiovascular testing, everybody that needs to be worked up, have a cardiac workup, pretty much needs to be transferred somewhere else. And somewhere else, most of the time, has no room for them. And so they'll just sit and kind of rot in your ER for days, often until they just raise the white flag. And they're like, I understand I'm taking on some risks here, but I haven't, spontaneously combusted here in the last 2 days. So I think I'm just going to go. So the Cosmos in that setting is like totally invaluable, because for some of these folks, it's like literally the only meaningful cardiovascular test they're going to have for like 24, 48 hours.
Wow.
And so I use it in like pretty much all manner of like cardiopulmonary complaints, whether it's like chest pain, trouble breathing, tons of abdominal complaints as well. But it's really like it's the cardiovascular situation at some of these rural hospitals that has really been exacerbated by the loss of staffing, or just the instability in staffing. And that's kind of a thing that's happened at all hospitals, is when you have this super unstable workforce. Because even at hospitals that don't struggle to recruit, now they're recruiting against, a hospital that's offering $125 an hour contract for a nurse. And so a small hospital loses 12 nurses to various parts of the country where they're offering those contracts, and now you're in big trouble. So that's kind of like the manner in which I use the Kosmos, and the clinical use of it at a place like Allegan, which is a rural critical access hospital, is invaluable. Like the case I had emailed about was just like the most stark example, because that patient had an immediately life-threatening illness that she had presented to medical care in that same county, the next town over, 2 days prior, and there was really nothing that they could do. I mean, they sure could have maybe gotten a little closer to the answer, or maybe even just transferred her to a hospital right then and there. But without any ability to do any sort of like meaningful testing to triage the patient's level of illness, they just kind of had to like order some outpatient tests and hope for the best. And that's basically what happened. So, but when she got to Allegan, it was really a godsend. We had that ability to, do a point of care ultrasound of her heart and lungs, and just immediately kind of crack the case. Because if she had delayed presenting for care by another day or two, if she had come in for care and kind of not had the appropriate testing, she certainly could have died. Like her myocarditis, which is inflammatory condition of the heart, was just that severe. I mean, it was a shocking moment. And it's one of the cool things about ultrasound, actually, no matter how long you do it, and I think Lenora can probably agree, there's this moment of like, I'm about to put the probe on the patient and I could literally see anything. You sort of know what you're going to see some of the time, because you might know this patient from previously, or they've told you 2 minutes of their story and you're kind of like, yeah, I got it. I know what I'm going to see. But you never really know, because once in 10 times, once in 15, maybe once in 20, you put the probe on the patient and it's like, oh my God. Yeah, I would have thought this in a million years.
Wow.
And I don't know how we would have figured this out without being able to do this. And so that's where I think, technology like this, that's portable, that's, I think, approachable. A lot of ultrasound systems are not really approachable for new users. And that's, part of my job as a teacher, is I kind of, dumb it down, or get the user up to a place, and the machine down to a place where, they can talk and it can be approachable. They don't have to be, scared of all these buttons on the machine. And I'm a pretty high-end user myself, like in terms of pickiness. Like I'm pretty picky. I'm like pretty quick to critique different systems that are presented to me. And in general, I don't like automation on my scanning. Like when I'm the one holding the probe, I like to have all of that like manipulated by me. So I'm like kind of a tinkerer, fine tuner. And so in general, like automation and me, like I don't use it. Like even on our cart-based systems at Grace, like there's like some auto-optimized button that I don't think I've ever touched. And I sort of cringe when like a resident touches it too, because I'm always like, wow, you should learn how to do this yourself, So I'm kind of a tough audience, but I think the Kosmos does provide like enough like ability to manipulate the image on your own, with the different frequency settings, and the different I guess it's like the different presets, like the lung preset, the EF preset, the abdomen preset. Then, they're different enough that I think you can kind of work through them in a trial and error basis and still feel like you kind of own the machine, like you have some control over it. Whereas a lot of the other portable systems are just like, this is what you got, sort of make it work. And they're very good. Most of them are quite good. but they tend to appeal for more of a more novice type of user, whereas I will get those systems in my hand and just kind of like turn my nose up at them.
Is that because
a
lot of time the imaging quality just isn't there?
Yeah, I mean that's kind of like I think I've written this or said this to somebody for the company before, but I think that on the technology and engineering end, they've obviously made a commitment to not sacrifice the image quality no matter what. And I know when I was in Seattle, when they were first having us come there, look at the equipment and play with it, the probe case at that time was just like unwieldy. It was just too much. Whether it was like the circumference, the shape, the size, it was quite unwieldy. But you could tell that it was like that because they weren't willing to cut any corners on the image quality. And that's what they told us as well. And they've been able to kind of parry down the unwieldy nature of the probe without sacrificing the image quality. Because I think that's what, honestly, like the AI and all of the different, kind of algorithms you could plug and play, and I know all the things they have in mind are great. But I think the image quality for the cost and the size of the device is really their secret sauce. It's not the AI. I don't know if Kevin would agree with that, but I do. Because like it really matters. That's what matters. Like that's your CV, that's your resume. It's like your image quality. That's what people see.
You're absolutely right. Kevin would say that that is a real differentiator that comes up. When he himself is talking about the product, is just the fact that, look, it's one thing to have these huge cart-based systems that do everything and have the image quality, but they're unwieldy and you got to wheel them around. And especially in the early days of COVID, I mean, you had to go through these. It sounded like you had to go through these extensive sanitation processes that if you're doing a whole machine that's the size of a small child, that takes extra time, especially when you need that machine. But if you got something that is a tablet and a probe and you just wipe it down and you go, I mean, that's a huge advantage.